Hi, I'm John DiPersio. I'm from Washington University in St. Louis, and I've just had a great meeting here at AACR. I thought there were some terrific sessions focused on everything from heme malignancies to especially solid tumors. But more importantly, I thought there was a lot of important science that has to do with sort of targeting molecules using AI in various computational models. It's going to shave a lot of time off the years we used to take developing small molecules and immunotherapies. Now we can do it maybe just from um, AI-based platforms. So that's one thing I thought was great. I still think we have a number of things we have to do in the context of immunotherapies that, for instance, in the heme malignancies, we have still made no progress for the treatment of AML, the most common hematologic malignancy. So you've heard a lot about myeloma and lymphoma and my talk on T-cell malignancies, but the most common heme malignancy is AML and MDS, and we've made very little progress there, and that is really sad. So we need to fix that. And then for solid tumors, as I said, developing novel small molecules for diseases that have things like mutated RAS malignancies. I think this is also going to be a huge step forward for the treatment of solid tumor malignancies. And then finally, people are interested in using different effector cells to target solid tumor malignancies like macrophages or NK cells, and to armor them some way so that they're more active and they persist longer. And so those are also really exciting new approaches that I think will reap benefits long term. But I think we still have a long way to go, and we shouldn't rest on our laurels at all, because we have both challenges not only with developing better therapies, but also how to fund these better therapies and how to do it more effectively from the NIH perspective, and also from I think enhancing public-private interactions, which is something that I've been very interested in. How do you actually bring the private sector into the academic sector without too much delay and conflict of interest and complications that often occur when an academic institution interacts with a company? I think it's going to be very hard to have AI really replace much of medicine. I think some aspects of testing and some aspects of reading certain test results like x-rays, but to actually figure out what to do with a patient, I think it'll be decades and decades, maybe never. Maybe never. Certainly after I die, and after I die, it doesn't matter.